This is an interim report of a clinical trial that we've been doing, and the clinical trial is evaluating a multiple gene panel test. So instead of the older practice of testing only for one or two genes when people come in with a family history of breast cancer or colon cancer, this is a panel that tests 25 genes, so quite a few more than we used to. And the goals of the study are both to understand the yield when we do this bigger panel, what are the proportion of patients we find that have harmful mutations, as well as variants of uncertain significance, but also very much to understand the patient's perspective and the outcomes. What we found was that, in fact, at about 3 months after genetic testing, which is the results we're presenting, the rates of distress, of intrusive thoughts, of regret about testing were really very low. So we were encouraged that there doesn't seem to be an early signal for harm from this kind of testing from a psychological perspective. The significance here is that more and more patients are being tested with these panels, and much of the time the genes on the panels have risks that are not very well defined. So for example, we might have a patient who had breast cancer and maybe we find a mutation in a gene like CHEK2 or ATM. We think we're beginning to understand the breast cancer risk, but we really don't know the associated ovarian cancer risks. Early genetic testing these days, BRCA being a good example, is valuable in that it helps to define a person's individual risk of developing cancer. And so for the better understood gene mutations like BRCA1 and BRCA2, we have a really clear sense of what the ballpark of risk would be and what interventions can help. So for example, if we find a woman has a BRCA1 mutation and she's never had cancer, we would then be able to offer her intensive breast screening with mammogram and magnetic resonance imaging, or if she prefers, preventive mastectomy, and subsequently we'd be able to offer her preventive oophorectomy or removal of ovaries and fallopian tubes, which has been shown to be associated with improved survival.